Hey, manual therapy friends, it's Dr. David Midoff here, physical therapist over from El Paso Manual Physical Therapy, and I'm bringing you today's Research Review Monday. Just a day late. I got super busy this week. It's been crazy nuts here at the office. We're growing, we're expanding, we're hiring people, so it's been tons of fun and lots of work, but it's going to be good. But I am still going to bring you research because I freaking love it. So I love this particular research study today. I'm not sure if my therapist found this one or me. I lose track of who's finding what nowadays, but it's simply titled Evaluation is Treatment for Low Back Pain. Let me see if I can make this bigger here. Yeah, there we go. Evaluation is Treatment for Low Back Pain. This is out of the Journal of Manual and Manipulative Therapy, and it was released just this February. Whoa. So sorry, we're jumping here. Let me see if I could just change the settings. Let's do a continuous scroll. All right. So here's what this study's about. It was really cool. I thought that it was an impressive study. Just the whole thought that they were doing, the whole thought behind what they were studying. They weren't even looking at treatment. All they were looking at is the conversation that happens at an evaluation between a physical therapist and the patient, and any testing that's done in order to complete the evaluation and determine the diagnosis, or what's going to happen next after the evaluation's done. And what these researchers thought is that depending on how that evaluation is conducted, you might actually make the patient better before even doing any treatment. And I'm 100% in agreement with this, that it's so true. The way you talk to somebody, the way you handle them, it makes an enormous difference, and they can leave an appointment feeling better without you even doing anything. And it even begs the question of, is your treatment, your physical therapy treatment, even effective? Maybe it's just your relationship with the patient that's making them better. So anyways, what they did here, if you look at the methods here, they had 34 people, ages 57 was a median, plus or minus 18 years. So they range anywhere from about 40, 39 to, we're looking at 60, 70 or beyond. And a little over half were female. So they blinded it. And what they did was they had one physical therapist do the beginning part of the initial evaluation. And then they had another physical therapist do the normal history taking. And what they found was that there was a significant reduction in pain just through the history taking without even doing the actual assessment part. So you can see this sentence right here in the results. The most significant reduction occurs after history taking. I thought that was so cool. And I love that just because it's where you connect with the patient. It's where you explain, where they get to share with you what is going on with them, and then they're reading your body language, your nonverbal language, and also you're probably interjecting things about what you believe as far as your expertise about what's going on in their case. So it can allow them to feel at ease. And if you read the study, I'll make it available to you, of course. It talks about how the patient is probably catastrophizing in their head. It's hard to get outside yourself as a physical therapist because you know what's going on. You know how common back pain is, for instance. All the terms. And so if you go to a physician because you've got a back problem, you're probably going to be able to guess what they're going to tell you already anyway, being a physical therapist. But if you look at it from the perspective of a person who's not at all educated about medical stuff, and they hear these giant words, discogenic disease or degenerative disc disease, and radiculopathy and herniation and sciatica, and all these words are really scary to them. And the way I look at it is, like, as a physical therapist, if you're not into this kind of stuff, I kind of have to do, just being in business. But if you're a physical therapist and you hate legal jargon, that's essentially, if you think about going and go read a contract, like if you ever go purchase some big thing, like if you go purchase a house or a vehicle, or gosh, when I went skydiving that one time, I had like 50 pages of paperwork to fill out. And just reading through all the legal jargon, or even simpler, just whenever you sign up for some online membership for something, or you download an app from the App Store and you get this the terms and conditions agreement, and you have to hit the I agree button. If you ever look at that paper that has all the legalese, it puts you off, and you don't know what half of that means, and it's kind of scary, and you just kind of agree and move forward. But there's this sense of like, I don't know what I just agreed to. It's kind of scary. I'm uncertain about what's going on. Well, think about that feeling that you get, but now with you having back pain and not knowing about what's going on and not knowing who to trust, and hearing stories of other people who got screwed over, or people that had back pain, went through this treatment, didn't get better. Your parents had the same thing because it seems to be hereditary is the thought. And there's this loss of control that the patient has. But when they talk to you, when they sit in that evaluation room and talk to you, and you come off as nice and understanding, and you give them space to talk, and you nod your head and smile, and then say stuff like, this is completely normal. People your age get this all the time. It's actually not as bad. I know it hurts a lot, but it's actually very treatable. It's very fixable without surgery. Just giving them those kinds of comments and that verbal language and nonverbal language is immensely relieving to the patient. Just calming the emotional aspect of their problem down can reduce the pain in the whole problem. So I love that they did this study. I thought it was so cool. And we're talking manual therapy. This isn't even manual therapy. There's no techniques here. There's no manual therapy techniques. There's no force measurements we have to look at. It's just simply building a good relationship with people and talking to them well. And another way to think about it, in case you're out there and you're wondering like, well, I think I do it well, or I think I need to do better, and how do I get good at this? Just think of dating. If you go on a date, you get to know each other, and you share. It's back and forth. It's not all one-sided, not all therapists talking about what they think, or not just the other person, the patient in this case, talking about what they think. And it also can't just be all a bunch of jargon. I mean, just think of it. If you were, I don't know your situation, if you're single or married or whatever, but just pretend that you're single if you're not. And if you went on a date with somebody who's not in the medical field, say you went on a date with somebody who's like an attorney, or just engineer or whatever, they're not in the medical field and have zero idea about that. Like, you just wouldn't use 5-syllable medical terms around them, because they would feel lost and turned off to the prospect of continuing the relationship with you. They just wouldn't. They would leave that date and say, I just didn't connect with that person, and I don't think it's going to work out. I'm not going to call him back, or that one date was enough. I'm moving on to the next person. It's the same darn thing with patients. You can't say degenerative disc disease over and over again. You can't use muscle names over and over again. You just can't be big with your words. And here at our clinic, we see medical people all the time: nurses, dentists, physicians, even surgeons. And I still don't use the big words with them, because they're in their own specialty, and many times they don't even know our own jargon in the physical therapy field. So it just, to make the relationship that much more smooth, I just can't do it. I mean, just think about it. Those of you that are physical therapists out there that have physical therapist spouses, because y'all hooked up in PT school or right afterwards or whatever, and if you're doing different specialties, like if one of you is inpatient, one of you is outpatient, or peds or whatever, like you can't have the same conversation with the same jargon with a peds therapist that you would an outpatient therapist or a wound care specialist, or if you pick the specialization, you just can't have that same conversation. So you have to really simplify the jargon and get rid of it and make it super simple. So I literally say things like, for a back pain patient, I'd say, hey, this disc problem that the doctor told you have on your MRI happens all the time. It's quite normal. Don't worry about the whole degenerative disc disease terms. They're big, scary words. In reality, it's going to get better. It's going to stop hurting eventually. I'm going to help you make it go faster, and I'm going to help you keep it away for as long as absolutely possible. I'll show you what to do to keep it healthy, and so that you have control over how to keep this at bay, so it's not coming back over and over again. It is possible to completely avoid surgery, even if you're 50, 60 years old, or your mom and dad had this problem. We do it here all the time, and it's going to get better. Simple as that. You just say something like that, and all of a sudden the patient's like, oh, I connected with that person. I trust that they made sense. And I'll even show, if I have to explain something anatomically, because I get that, you get those patients who just ask a lot of questions. They're real intellectual. They might be like engineers or something like that. I'll get out the skeleton. I'll be like, you see this bone right here, and you see the disc right between the bone there and there? That's the one that's affected. And when I check this and that on you, that's the one that was hurting. That's why I hurt when I did that test. But look, you have all these other joints nearby, and those need to move better, so I'm going to free those up for you. And then you have all these muscles around here. This one's weak. I'm going to show you exactly what to do to get that one stronger. It's actually quite straightforward. And after some time and repetitions of you doing this and me working on you and all of it coming together at the same time, you're going to feel great, and you're not going to have any surgery. This is the likelihood of you having surgery is going to extremely diminish. And you're going to be able to get back to running or exercising or just doing your yard work or whatever it is that you like to do, fill in the blank, without a massive problem that's going to set you back. You have to take medication for, visit the hospital, or frequent the doctor for injections, or get that stupid surgery that you didn't really need because PT was going to help you out. So anyways, sorry, I got in a soapbox about this one. I just had to go over it. I had to share it because it is so critically important for any therapist, whether you're manual therapy or pediatrics or geriatrics, inpatient. I think just having a solid conversation, as long as the patient's coherent, or the family of the patient, that's a good one to talk to as well. This goes a long way. And this really separates us from just about all the other medical professions, because we have time with patients, unlike other medical professionals. Maybe nursing can have some time, especially like CNAs and stuff like that. But physicians, forget it. They got a few minutes. They got to quickly get a few questions, check a few things, and prescribe a medication or treatment or refer them or something. There's not much time for relationship building. So the patients just don't connect with physicians as much. They just don't have a shot. The business model for physicians' clinics just doesn't allow for it. Nothing against physicians themselves. I'm sure they're all, most of them are fantastic people. I know many, and they just don't have time because of the business model. Physical therapists, we have more time, so we can do it a little bit better. So if you take that time up front, you can immensely reduce their pain at the beginning, and most importantly, get the buy-in so that they stick to the plan that you're going to put them on and meet the outcomes that you need them to meet. All right, I'm off my soapbox. Comment below if you have any questions, if you have any concerns, if you've seen this study before, or what your experience is. I'm interested to know what you're feeling out there. Hey, if you're not really doing this and you're kind of like, oh, I should start doing this actually, that's cool. I'd love to hear any questions you have. I'm happy to share things that I say with patients. I want you to be successful in treating the patients that you've got on your schedule so that you can do the best job possible. Anyways, have a wonderful day, and we'll talk soon. Bye-bye.